My name is Alireza Panahpour. I am royalty of my country, what remains of my country, Persia, Iran. As a child, I was groomed to be a warrior. I spent my childhood in boarding schools, military schools, to be of support to my country. But after 1979, when the fall of Iran, we've lost many uncles and cousins who were in the military, and my mom wasn't about to have it. She took me out of military school, and instead of following my forefathers' path, I ended up following my father's path. My father's also a surgeon. His father was a surgeon, his father was a surgeon, and his father was a surgeon. So you can say it's kind of in my blood. Really early in my career, I realized what I was being taught in undergrad, chemistry, physiology, histology, biochemistry, genetics, had one thing in common, and that was the periodic table. But now I get to dental school, and they're telling me that the second most toxic substance on this earth, which is mercury, and let me remind you, number one is plutonium, and what do we do with plutonium? We make atomic bombs with. And second is mercury. Now suddenly mercury, it's safe. I raised my hand, I spoke out. Of course, as a child, getting kicked out of my country due to governmental financial reasons. Now, as a young doctor, I wasn't going to have it. Of course, a lot of that was my own filter. So I started speaking out. But one thing I realized really early, that the more I learned, the more I saw. The eyes cannot see what the mind doesn't know. So that's truly where my path began, curiosity. If I heard of someone in Zimbabwe that was doing something interesting, believe me, I would be there. As Andre was talking about, I also met a dentist, heard about a dentist that had moved to New Zealand. This dentist was treating Down syndrome children. And through cranial restructure, he was able to get these kids back in school to be a functional member of our society. Of course, he got kicked out of the States. They revoked his citizenship, an American citizen, and they shipped him out to New Zealand. I went and knocked on his door. Of course, first time he called me a wanker and kicked me out of his house. I went back again, kicked me out again. On my third attempt, the neighbor saw me. He said, barbecue and Blue Label whiskey. My fourth return, barbecue and a Blue Label. So this is the path that I've traveled. An average dentist is supposed to have about 60 units of continuing education every 2 years. I average about 300 a year. So again, the eyes can't see what the mind doesn't know. I do have a book out, which I shared my thoughts, my education, my path, for whoever's interested. We heard quite a bit about epigenetics today. Oh, before we get there, so, I've been called a lot of different things. Quack, holistic dentist, biological, systemic, what have you. But at the end of the day, my favorite is a conscious dentist. A true conscious dentist. Awake, aware, and curious. So, I was going to talk to you about getting to epigenetics, but we had a pretty good explanation on it. I'm going to talk about nutritional deficiencies, which are cause of smaller jaws and crowded teeth, treating crowded teeth with appliances, early prophylactic wisdom tooth extractions and NICOs, and some of the environmental factors that's affecting us and our mouth and body.
Use the microphones.
I'm sorry. Okay. So, definition of epigenetics: study of process by which genetic information translates into physiology, biochemistry, developmental anatomy of a person. Very simple. I mean, we knew about this stuff 300 years ago. Gurus, shamans talked about this. If your grandparents loved each other, took care of each other, that has a ripple effect, a resonance that's embedded in your DNA that will show itself 3 generations later. But if your grandparents killed someone over a piece of land, were mean to each other, that also has a ripple effect. But thank God, due to research, advancement in technology, the research is there now. I'm just going to go through this real quickly and really get to the nitty-gritty of my lecture today. So basically, imagine an orchestra as your DNA.
Microphone.
Imagine the orchestra as your DNA. And the epigenetics is the environment which will show itself in a different physiological, histological manner. For example, you all heard about the savanna theory, right? The monkeys ate all the food, lived on the trees, not had to come and stand on ground and walk upright to be able to see further and blah, blah, blah. Who knows about this theory? We were raised with it, right? Wrong. New research through physiology, anatomy, human skull is telling us that within the past 60 million years, there's been 5 distinctive shifts in our cranium that has allowed a different dynamic, which has allowed hormone production, eyes coming forward, perception, etc., etc. And what's responsible for that is the sphenopalatine bone. Sphenopalatine bone resides right behind the eyes, behind the maxillary sinus. Looks like a little alien ship, actually. Looks like a little butterfly. And within the past 60 million years, this bone has gone through a shift. No one knows why, no one knows how. It's like that information has been embedded into this bone. And with every shift, our jaws has gone smaller and our cranium has gotten bigger. And because of that, more oxygen. I mean, this is a weekend lecture, by the way, but I'm just going through it real quickly with you guys. And of course, there was the matter of fire. And through fire, we were able to cook food. And through that, we were able to get different hormones into our system, which had a lot to do with our evolution. So 60 to 40 million years ago, that was the first shift that actually brought the eyes from the side forward. And that was very important for our perception and consciousness. Second shift was 20 million years ago, then 6 million, 2 million, 160,000, and of course, we're still evolving, is what is referred to as Homo futurus. If you go on YouTube, there's a great movie right now on this. Very interesting stuff. But let's continue. And let's talk about some of the work that I do. Well, I look at my patients as a whole person. I look at their teeth as a whole person. All right, so 5 levels of being. A pyramid. On the bottom, we have the physical body. Energetic, mental, intuitive, spiritual. We're going to get into all these levels one by one. But something very interesting we saw, the patients that were spiritually and intuitively in a good stature, that means they had a good relationship with their creator, a good relationship with their passed, everything we did for them had a beautiful ripple effect. One vitamin C went a long way. One chiropractic adjustment went a long way. But patients who were stuck in the physical body and this energetic body, that had forgotten about their higher self, 10 vitamin Cs, nothing would happen. 10 whatever treatment, nothing would happen. So I can't tell you how many patients I turn away that come to me that have lost their connection to their higher self. No matter what I do with these people, they're not going to get well. It feels like they're chasing their illness. And those are the patients I stay away from. Go read this book, go do this work, and then please then come back to me. So, and of course, in reality, all those levels are in one. So let's look at the physical body. That's the base. In this physical body, we have our experiences is sensation, action, and movement. I have a question. Hi. What are the five senses? Quickly.
Smell, touch, taste, hearing, put me on the spot, I think about it.
That's one question I ask every patient when first time I meet them. And believe me, the one that they miss, or the two that they miss, I know they have issues with those things. So if my patient forgets, talk about the eyes or the ears, I know they will never listen to me and they will never be able to see themselves getting better. What are the five senses?
Touch, hear, see, smell, taste, and proprioception.
Well, proprioception is all together, but that was cheating. But that was okay. We'll just get away with it. So in this physical body, we have structure and we have biochemistry. Related sciences, mechanics, and chemistry. These are some of the methods we use to help us with this. And some of the treatment techniques, like nutritional therapy, nutrigenics, exercise, osteopathy, chiropractic, etc., etc. Listen, okay. So physical body, again, right? A vehicle to get from point A to point B. I just turned 50 this year. But I tell everyone I'm 55. Oh, you look so good for your age. A little tricky, guys. So that's our physical body, literally. And of course, nutrition. Remember, we're still in the physical level, right? The base, nutrition. Tooth decay. Tooth decay is primarily due to lack of minerals. When the body is looking for the next source of minerals, and one, it's either not able to digest it, two, it's not getting enough of it, three, dealing with some toxins, what happens? The body looks for the next source. Starts sucking it out of your bone and out of your teeth. Your body becomes pH negative. The bacteria in the milieu starts working overtime. So, nutrition. With every children that comes to me, my first question, what is their diet like? Are they pooping every day? If you're not pooping for 2-3 days at a time, there's definitely something wrong. And for me to go there and give you anesthetic, that's going to stress your liver more. What am I doing? Nothing. I'm hurting that patient even further. And we know from Dr. Weston Price, he was a missionary, traveled the world. He would see patients that grew up in the village, ate nuts and berries and fresh air, and he looked at their jaw, white teeth, bright upper jaws. Were children who grew up in, the town, ate Cocoa Puffs and nacho Doritos and burritos and McDonald's and what have you, misguided teeth, misaligned teeth, crowded teeth, decay. So good nutrition, very, very important. And that good nutrition on the physical body also has a ripple effect. I tell you this thing. Patience. 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 Patience not working. Come on. There we go. So, nutrition was a big part, and second thing, structure. Was it you that was talking about structure earlier today? Who talked about structure here, how important structure is? So we know that teeth are complete manifestation of our structure. The bite, shoulders, and hip. These need to be in harmony for certain energetic movement, physiological movement to occur. We're going to get into this really heavier. So, upper teeth are embedded in your upper jaw. Your upper jaw supports your orbits. Maybe the battery's running low on this, you guys. Yeah. So upper teeth embedded in your upper jaw that supports your orbits. Lower teeth embedded in your lower jaw through the TMJ back of the skull. So the front of your skull is truly guided by your upper teeth. Your lower teeth through TMJ is back of the skull. These 16 bones that are embedded together like a jigsaw puzzle, again, are guided by your teeth, C1 through C7. And of course, you have the balancing muscles, muscles of mastication, the eyes, orbitalis, frontalis. So this is the first thing I truly look at when my patients come to me, is their posture. If I have a patient that comes to me, one shoulder's up here, one shoulder's down here, and for that the hip has compensated, which the neck will compensate, and this patient wants to get all these mercury fillings out or what have you, well, I know that the stressors on this side are so much, I'm pretty much going to be married to that patient, because that patient will keep on coming back with broken teeth, fractured teeth, and what have you. So I will not take your case unless you allow me to help you balance also. Why this is so important for me? Well, lower jaw, back of the skull. Look at the arteries, the vein, the neurotransmitters that exist within this area. The blood flow into the brain. The dumping of toxins out of the brain. When all these muscles of mastication get stressed due to a disharmony, well, muscles get shorter. Muscles get shorter, they pull the jaw backwards. The lower jaw goes back, takes the epiglottis, takes the tongue and the epiglottis back with it, cuts your airway. If you look at all these dental appliances, what are they meant to do? Bring your lower jaw forward so you can breathe better. Now this, we see this is a result of clenching, grinding, lymphatic issues, cranial issues, the list goes on. Look at what's involved in this region. The musculatory system, circulatory system, blood supply, blood-brain barrier, lymphatic system, salivary glands, nervous system, spinal system, endocrine, respiratory, all of that, this engine is responsible for this. So if this is not working properly, if you are dealing with toxins, mercury fillings, root canals, and what have you, is going to make these function much, much, much harder. Are you guys with me so far?
Yes.
Good. Okay, Chris, for your birthday, I'm going to buy you a new one of these. Where are you? And of course, I use a lot of different appliances to help my patients achieve that harmony. And I can't do it alone unless I work with specific chiropractors that also understand this movement They call these chiropractors SOTO specialists, sacral occipital technique specialists. So what I do, I put my patients on different appliances to bring that cranium into harmony, to relieve some of these stressors of these muscles that are going through. Allow the patient to breathe better. And from there, you start seeing this musculature relax. That's when my work with the chiropractor begins. They see the chiropractor. As the chiropractor brings the shoulders, hip, cranium back in motion, I adjust my appliance to those new shifts. And eventually we'll get to a point that we're truly harmonized, and that's when we lock our teeth in. I'll show you guys a few cases. And we use different technology to look at the biting forces of the teeth. Every time you bite down, there's 350 to 700 pressure that comes together. That's quite a bit. Every time you bite down, there's a surge that goes through all your meridian and acupuncture points. Every time to bite down, there is a beautiful ripple effect that takes over. So, first patient, that these patients have allowed me to talk to you about these cases. Look at the shoulder, left shoulder, right shoulder, hip. So this is a compensation. And look the stressors that this shoulder is putting on this area. 1 week of wearing my appliance, I was able to, little bit, calm the hip down. 2 weeks, start calming the shoulders and the hips down. If you look at the face, I'm sure I don't have a picture of this, but her face, she was angry the first time she came to us. And little by us calming her system down on the structural level, we start seeing a smile. Another patient, she looked like a little military. Shoulders, hip, that had caused her knees to even go in. Within 2 weeks, look at the face, look at the shoulders, look at the hips. She was so much happier. What did I do? I removed her from a fight and flight type of an existence. She went from fighting for her life to looking upright. That's really what I did here through appliances. Now she's happy. So, the bite is in complete control and in conjunction with that posture. Now, why did I show these two cases? Both of these patients had thought they had gone through menopause. Within 2 weeks of their treatment, I get a call, Dr. Panah, what? I got my period.
I'm not coming.
I said, great, thank you. I'll make a note of it. But thank you for sharing. Now, why did that happen? Guess where you have more hormonal receptors than any other part of your body?
Your jaw.
Your TMJ joint. So by me calming the system down, bringing the cranium in a good position, allowing lymphatic movement. How does our lymphatic movement work? That cranium, the 16 bones that are integrated together, every time you breathe in and out, there's a movement. It's like a pump. And that pump is what runs the lymphatics. That's why exercise is so good for you. But if you're here, there, your eyes are here, your ears are here, which means what? If your eyes are apart, that means the whole upper jaw has lifted and the lower jaw follows it. So these joints are in complete stress. Very powerful work. And I've had patients that call me the next day, they're like, I'm having the worst time because I got the parasympathetic working. You guys know sympathetic, parasympathetic, right? Sympathetic, fight and flight. Parasympathetic is healing. And some of these patients were not ready for that healing modality because they've been fighting for so long They don't know what healing is. Okay. We'll get into that a little bit later too. Now, in order for me, so I know that the teeth are the foundation of structure. So, if someone comes to me with tooth decay, and I know that tooth has to do with the structure and a bunch of other things, I want to use less traumatic procedures to help my patients. So at times when I can, instead of drilling, I use air abrasion. It's like air blasting. Decay, you air blast it away, you put a filling on there. Kids love this. No anesthetic, no numbing. Of course, I'm quite conscious about the material I put in there. Most dentists use composites, or mercury, or other toxic materials. I use glass-like materials. Very expensive, very hard to get. I have to order it way in advance, but very clean. Just because a filling is tooth colored and there's no mercury in there, that doesn't mean it's safe. You have a right to ask your dentist for the MSDS sheet of every material that's used. So if your dentist wants to put a tooth colored filling for you, wait, can I see the MSDS sheet? And if you see BP, methyl methacrylate, polymethacrylate, you definitely want to stay away from that material because these are all cancer causing. Again, dental air abrasion. Now, dental air abrasion can only be used on virgin teeth. If there's a filling here, I can't use it. I have to spend 4 days removing it. Okay? Air abrasion and put a filling in there. Again, I try to follow different path of what I was taught in dental school. In order for me to become a biomimetic dentist, I had to spend about 4 years, travel all around the world, studying with these masters. We do have an academy, Academy of Biomimetic Dentistry. I'm actually instructor for that course. Next time you guys want to go to a dentist, are you a biomimetic dentist? No. Thank you so much. Example, silver filling. This is what it looked like after when we removed it. Could we bring the lights down a little bit, you guys? Is that possible? No? Okay. You see this goo? This is not decay. This is the mercury that has been leached out of that filling and been absorbed by the tooth. 90% of the dentists, when they see this, because they're able to get away with it, they'll drill through all of that, and that tooth is a root canal now. And they can justify for it. But this is not decay. This is goo. Mercury goo. But also look, multiple fractures. Multiple fractures. Why? Well, because the tooth is biodynamic. When you put something solid in there, every time you bite down, every time you chew, you throw these fracture lines in there. That's what I couldn't understand in dental school. Why do you get a little filling, and then a bigger filling, and then a bigger filling, and then a crown, and then a root canal, and then an extraction, then a partial denture? Every patient I came across in dental school, at least the 300 patients that were given to me by the dentists who graduated, this is what I saw. And I suddenly saw my life. I'm going to be a drillet, fillet, billet dentist. No, I refuse to. That's impossible. We're all so different. So, I want to get rid of that decay. I know if I start shaving that little bit of that decay that's surrounding, there's a good chance I might hit the nerve, because I can see a little hit of the nerve right there. So what did I do? Ozone. 25 years ago at a lecture in Switzerland, I was introduced to ozone technology. My first ozone machine, I had a friend of mine to buy it in Canada. I sneaked over and brought it here. Didn't tell my patients that I was using it. I was afraid someone's going to call FDA on me or whatever. Oh, by the way, is anybody here from ADA, American Dental Association? If you are, you know you have to stand up and tell me. Is anybody here from American Medical Association? IRS? FBI? CIA? Okay. You know you have to stand up, right? Okay.
Let's see if we can put some more batteries in here.
All right, sounds good. So through ozone technology, 60 seconds, and I'll show you the picture later. Of course, now I created 2 different research programs. So I'm allowed to advertise my ozone equipment. Dr. Edward Lynch, who's the father of ozone in dentistry, I'm sure you've heard of his name, Andre. He's been one of my mentors, and he is the head of the Warwick University Dental School in England. And through that connection, I was able to put this research together. Much better. So, look at all the surrounding. You see that? From there, it's just funky. There we go. Third the charm. All right. There's a will, there's a way. So, but remember, we had these fracture lines, right? If I put any material on top of that tooth, and every time you bite, you'll be impinging, pressing upon that fracture. And that fracture will go deeper, hit the nerve, and there goes the tooth. So what we do is we place thin sheets of Kevlar. They use Kevlar for bulletproof vests, as you know. And that Kevlar allows a kind of like a little shocking effect that doesn't allow these fractures to go any deeper. Any dentist will do a crown on this tooth or an onlay on this tooth. I will not shave all this beautiful tooth away because of a couple of fractures or because the insurance company will pay for it. And then strategically, as you can see, I start building up my tooth, cusp at a time, just like the way it was meant to be. And I always, and this, of course, when I'm doing that, this is what I have in mind. This is what I want the forces to look like. And I tell all my patients, God forbid, if you, well, 3 dentists told me I need a crown. You're doing just a filling for me. Yeah. If this breaks, God forbid, I will credit you the money you've paid for this filling, and I'll do a crown for you. I haven't had one single patient come back yet after the biomimetic way. I get a lot of patients also from, you know, I went on the internet, I saw a holistic dentist, probably this guy that took a weekend course, and on Monday, you know, he's a holistic dentist, or he pays some organization to be a part of that holistic dentistry, what have you. I just had this filling 3 months ago, and it's breaking down already, and it's causing me pain. So I removed the old filling, and look what I see. Nice little fracture going into the nerve. I do my Kevlar, build it up. This is 2 years, this is 5 years. So biomimetic way. Again, 99% of dentists out there would put a crown on this tooth. I would never. I would build it up from scratch because I know it will last longer, actually. Patient came to me. I want a better smile. I'm about to get married. I've been to so many dentists, 50,000, 40,000. They want to veneer my teeth and da 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 da. No. All we did was rebuild these two front teeth for him. And look how the smile changed. Why? We see each other as a reflection of light. All I did here was change that. Well, can I go back here? Yeah, I went from this. Look, I didn't touch anything else, you guys. And I only did the fillings on these two front teeth. So just by changing the reflection of light, he was happy enough to go get married and save thousands of dollars. Again, it's about truly being conscious, you know? We talked about air abrasion, ozone, of course. A little bit anatomy of a tooth. What me and you see when we talk to each other is enamel. After diamond, enamel is the second hardest structure. So enamel is very inorganic based. Under it, we have dentine, very organic. And then within that structure, we have a nerve, an artery, a vein, and a lymphatic. So theoretically, every tooth is an organ. That's why they refer to as doctor of dental surgery. Because if we're shaving on a tooth, we're shaving on live tissue. Okay? So you know that the Mercury Fillings, guess who owns the patent on Mercury Fillings? American Dental Association. In conjunction with the FDA, a joint venture. ADA and FDA own the patent on Mercury Fillings. So, and they describe it as a device that it's used outside of the body. So what you're telling me is that my tooth is not a part of my body? How were they able to get away with this? Well, you know, in the state of California, it's against the law for a dentist to tell you you have mercury in your silver fillings. Most of the states, there's a gag law number 14. Imagine the lobbyists that make this happen. But how? Teeth, just like skin, is an ectodermal derivative during embryonic stage. That's how they got away with it. Again, good money, good lawyers, right? Yeah.
Say that again, your last sentence.
Good money, good lawyers. Teeth is a derivative of ectodermal. Ectodermal also does, skin is also ectodermal. So they use that excuse, saying that teeth are not a part of the body. So we had the physical body, which was nutrition and structure. We know that structure is very, very important, and also nutrition. I want to do a little demo, a little something. Make sure you've got some strength in this shoe so we can have some fun with it.
Chris.
Stand up, Chris. Do you have a business card with you, by any chance? There you go. Thank you. Okay, stand right here for me, please.
Should we turn the lights up for this?
Yes, please, go ahead.
Yeah, okay, good.
Yeah, look at everybody.
I'm not paid by him.
Yeah.
Just
I
paid
mean,
today.
he looks like he's an athlete. He takes care of himself, right? Yeah. Okay. So I'm just gonna look very carefully, and what I see is that the upper shoulder is a little bit higher than the left shoulder, and the upper hip is a little bit higher than the left hip. And if you look really carefully, you can see that the eyes, the right eye and the right ear, are lower than the left eye and the left ear. Yeah. So hold on to this for a minute. So what I'm going to do is I'm going to just shift his bite just slightly. I'm going to use his own business card to do it. So, now, Then I'm going to run him through some reflexology movements. Not kinesiology, reflexology. Before there was imaging and what have you, chiropractors, osteopathic surgeons used reflexology to see where the problem coming from. So, open for me, and bite down gently. Good. Put your hands up, make a fist, thumbs up. I'm going to open your jacket up, make you a little more comfortable. Okay. There you go. All right. That's your C1. Remember, C1 through C7 controls your cranium, correct? I'm going to push down, he's going to push up. Push up. Thumbs forward. C2. C3. You guys get the idea, right? Mm-hmm. Open up, bite down and swallow.
Probably something attached to that at the end of it.
Bite down and swallow again. Hands out, go to C1 again. Good. Push up. Thumbs forward. Push up.
That's ridiculous.
Come on. You're kidding, right?
I could probably lift you up right now.
Can you?
Right? Yeah.
Can you?
Yeah, I think I can.
Well, if I put that back in your mouth, maybe you
Probably.
Okay. C3.
Oh, come on.
Put that back in there. So by just shifting his bite, within seconds, not only I increased his tensile strength, but there was also a beautiful ripple effect that happened from there. No, don't. Bite down, open, and bite down. Good. Hands out again. Make a fist. Push up. So I really have to, but in his mind, I already messed him up right now, so he doesn't know anything. Have a seat. Thank you. Correct. Correct. So structure, very, very important. When these muscles are in spasm, because of that occlusion, that has a ripple effect throughout the body. I was going to save this till the end, but I'm going to say it now. What does tooth decay, gum disease, infections in the jaw, TMJ, postural, dental, all have in common? Come on, what do they have in common? They're all the chronic inflammation. Chronic inflammation that's impinging upon your immune system constantly. Remember, chronic inflammation is responsible for 80% of our healing crises for our autoimmune diseases. That's the way I look at things. So, let's continue. Let's look at the energy body. What do you have in energy body? Experience, emotions, sixth sense, energy perceptions. In this energy body, we have the nervous system, meridians, chakras, bioelectrical system, microtubule, and biphoton field. So this is really physiology and physics. But the nervous system is a huge part of this. And of course, we know that through mapping, every tooth has a not only energetic and meridian, but also a connection to distant organs. A bunch of nerds got together, sat down, had nothing else to do. They tracked each tooth to different parts of the body through your central nervous system. I offered this guy $5,000 for this picture. He won't sell it to me. Look at that. This is your central nervous system and all the accessories. Look at the energy that's here and here. Hence the word craniosacrum. We were doing good, yeah. So, if I have a patient that comes to me with a bunch of metal fillings, mercury, metal, what have you, well, let's take a step back. Remember our cranium? Fifth cranial nerve comes in to a huge ganglion, I like to call it a server, called the sphenopalatine ganglion, or Gisserian ganglion. Interesting enough, if you look at any current medical book right now, They don't even have this anymore in the pictures. I don't know why. From this sphenopalatine ganglion, we get nerve innervation to our forehead, eyes, nose, upper teeth, tongue, lower teeth. Everything within this structure is coming from that sphenopalatine ganglion. We also know a phenomenon called galvanic effect, which means that if you put two metals next to each other, they create a battery effect. Take two pins on your desk, come back tomorrow, they've attached to each other. Galvanic effect. So, if you have multiple metal fillings sitting in these areas, what have you done? You've created a charge, a battery effect that is affecting all these nerve endings, all the way back to the Caesarean ganglion. Now, this is really important when we do remove mercury fillings out of the mouth. Imagine this structure not only has been sucking the mercury throughout the years, but also is being used to that charge. Within an hour, I remove that charge. What is the central nervous system going to do? Whoa, whoa, whoa. I've been used to this environment. Suddenly, right now, there's a different environment. What the hell? These nerves start firing. So acupuncture, neural therapy, to calm this down, it's very, very important. That's why also we have our patients on chlorella, vitamin C. So as these structures are firing and releasing into the blood, you have the vitamin C, the glutathione, to wash this out. Depending on how strong you are, I might alter your protocol. Anywhere from you get the mercury out, you're on an IV, you go to the colonic afterward, foot bath, whatever is needed to help take that out. Remember now, the American public have been polluted for 3 generations. From Safeway, McDonald's, vaccinations. Some of those biochemical mechanisms have been destroyed. There are molecules that are missing now to be able to detox naturally. You guys get where I'm coming from with this? Now, another picture, again, 5th cranial nerve comes in, your eyes are right here, sphenopalatine bone is here, this is the Caesarean ganglion, but look really carefully, we also have 1, 2, 3, 4 more little servers within this structure. You all know this graph, don't you? You've seen it, right? Sympathetic, parasympathetic. Every organ has a sympathetic connection to the spine. Fight and flight. If a tiger walks in here, me and you will run the fastest, me and you will jump the fastest. You've heard of stories, mom pick up cars to save their child and what have you. Sympathetic. Parasympathetic. There is 1, 2, 3, 4, 5, 6, 7 sympathetic servers within the body. Parasympathetic servers within the body. Remember, parasympathetic is healing, right? Well, look, otic, submandibulary, spinociliary, same 5 parasympathetic ganglions that govern your oral cavity. So out of 7, 5 of your parasympathetic servers that control your healing are within this cranium, within inches from your teeth. This is just like an electrical system. If there's a short circuit in any of your teeth due to infection, metal fillings, what have you, there is a ripple effect that will affect your autonomic nervous system. This is just simple anatomy, you guys. This is just simple anatomy. So theoretically, you're a physical structure that lives within an energetic body. That's the truth of it. I'll give you an example. Patient came to me, long story short, had to get her mercury fillings out. Before I did, I ran the patient through a little screening, and I knew that her scars, if I remove this voltage, that nervous system is going to kind of freak out. And scars are very important in that energetic flow. And of course, as a dentist, I cannot touch below the head and neck. So I asked her MD to be there to inject her scars.
What do you inject it with?
Buffered procaine. 1% buffered procaine subcutaneously. Procaine is a vasodilator, so it allows oxygen and blood flow to the area. And also, the biochemistry of it is very positive. So it will take all that negative nerve ending and shift it to positive. Allow energy to flow through that. I do a lot of neurotherapy for my patients after I remove mercury or infections or what have you.
Is it because of the effect on the myofascial system too?
No, it's central nervous system. But we know that we have nerve endings on the skin. So I'm just going subcutaneous. Few blep blep, that's it.
So to not have pain?
To allow energy to flow. Because remember, I removed a short circuit. That central nervous system is going to freak. If not, see, when patients come to me and say, every time I remove a mercury filling, that tooth dies. Really? 3 minutes is not going to cut it, my friend. You guys have 3 more minutes. Is that okay?
I got 30.
I got good for you. Let's do it. So this was a scar that we injected afterwards. Why? To allow energy to flow. If not, that firing can kill the nerve of that tooth.
So
Now you have one demon for another.
So you've taken the mercury out and it's caused that scarring from that one tooth?
Correct.
Okay, so
Because
every time
that-
you take the mercury out, then it scars.
Well, I'm calming the scars down. What are scars? Scars are cuts. What is health? When energy flows impedantly. Scar is a short circuit for that energetic flow. For example, stomach meridian starts from right here. If you got a cut or any cut on its, anything that affects its path is going to affect your stomach. Patient came to me. She's a guru instructor in Mexico. Since I got this root canal, I got puffs underneath my eyes. I can't have this. This is not good for my image. What's going on? Well, as soon as we removed the mercury fillings, they went away within seconds. That's for this patient. I see this kind of stuff with 1 in every 50 patients, actually. Really interesting. Very interesting. How the body energetic. We also know that through meridian pathway, dental infection have that effect. Look, this tooth was affecting lung, liver, and the ascending colon. I don't think I have time to get into biphoton light with you guys. So seriously, do I have 3 minutes?
Yeah.
Okay. Well,
Keep going.
Yes.
but if I get started, you guys. And of course, we deal with a lot of biphoton light. Biphoton, you know, Andre was asked the question, you know, how do we detox? Well, I'll give you the short version. Think of your body as 3 different compartments. You got your organs, soft tissue, and hard tissue. It's not hard to detox that. Supplementation, IVs, what have you. Then you have the milieu, where all these organs live in. They transfer information, nutrients, supplementation, and IVs and what have you. But it's the nervous system that is the hardest to take these toxins out of. Our central nervous system is a very curious system. When it sees a toxin, it's, come here, who are you? What are you? Just like we knew that herpes is able to live in the nervous system, now we know that every bacteria, virus, fungus is able to live in the nervous system. Only through biphoton light, cold laser light, we're able to withdraw these toxins out of the nervous system. What is biphoton light? Through cleography, they're able to see these aura. around humans, animals, what have you. What? Where is this coming from? Where is this aura coming from?
The energy in the body.
It's your DNA. Your DNA in its double helix formation is constantly mutating, producing light. All cells produce light. And this aura is a manifestation of your DNA. And through this aura, we're able to access your central nervous system. Again, this is a weekend course. Now, so we have the physical body, energetic body. Now, of course, you have the mental body, where thoughts, beliefs, attitudes, reality, long-distance healing. It's kind of what I like, you know, monkey see, monkey do, you know? I'm going to ask you to stand up for a second. Do you got your little card?
Get another one here.
Let's get another one going. I just want to show you guys something really interesting, okay?
So I brought a lot of extra cards today.
Go ahead and flip it over, and we can kind of do a little,
Same thing?
yeah. And then bite on the right side again, but put toward more back a little bit. Yeah, one more time.
Right on the right side?
Correct. Okay, put your hand out for me. I'm going to press down, you're going to push up. Just strength test. Push up. Okay. Now say one time, I can't do it.
Position with my mouth?
Yeah, just say I can't do it.
I can't do it.
What was that?
Can't do it.
Push up.
Come on.
Say I can do it.
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 Push up. Now, hold on. All of you think that he can't do it. You think that you can do it, but all of you think that she cannot do it.
Can't do it.
If Charma.
Can't do it.
Can't do
Can't do
it.
it. Can't do it. Can't do it.
All right.
Vampirism. Every time your heart beats, thank you again. Every time your heart beats, there's a frequency with a thought behind it that travels. So that's how we're able to affect our friends' family. So mental field, very, very important. I pay a lot of attention to this mental field when patients come to me. Okay? And then, of course, we have the intuitive body. Past lives, intuition, trance, symbols, angels, archetypes, meditative states, dreams, magic, out-of-body near-death experience. Systemic family constellation plays a huge role in this field. Again, what your grandparents did, that ripple effect. I was part of a research where we took a number of women and we really tried to help them in a confined environment to detox and chelate. We reached the wall. We couldn't go any further. We went back and looked at all of their health history again. We missed one thing. They all had one thing in common: abortion. Abortion. When we gave them an exercise, and it was interesting, every one of those people, their daughter or their daughter's daughter had a habit of cutting themselves. We found that later. So when we asked this woman to do a certain exercise by basically going up in the woods, putting a stick into the ground and making that a burial site for the child they lost, telling their husband and their children that they lost a brother, and honoring that child, getting a child a Christmas gift, having a place for dinner at Thanksgiving, their system opened up. Truly, truly amazing. One of my favorite quotes: the intuitive mind is a sacred gift, and the rational mind is a faithful servant. So your mind, be careful, always plays tricks on you. And of course, the spiritual body. And there's nothing you can do on this level for you. This is between you and your Creator. End of story. That's how I look at my patients.
Wow.
Now, are we done? Can I go on? Okay, no one says no. Great, good. So, what are some of the things, of course, I see in my office all the time? Chronic infections. infected root canals, areas of old extraction that were never cleaned out properly, or there was some blood clotting issue. You went to the dentist, popped your 4-year wisdom teeth out, you got food stuck there, a tooth broke, they didn't clean out the socket properly, the area closes, and it remains as a low-grade infection. And again, we know, what do we say about chronic inflammation? It's a common denominator to a lot of our illnesses. What we thought in the 90s, we were taught there's 300 different kind of bacteria in the mouth. 20 years later, there's over 2,000 different types of bacteria, virus, and fungus that live together in these colonies called biofilm. Who's heard that term before? Biofilm. This biofilm is what causes gum disease. Biofilm is what causes gut problems with the gut. They have found biofilm in every cancerous cell they have removed out of the body through pathology culturing. Now, a tooth, wish I could go back. A tooth is like a sponge. Yeah. These are the tubules. There's about 6 miles of tunnels within each tooth. And on a dead tooth, where there's no oxygen, these biofilm colonies can go deep and hide within those tubules. So if anybody tells you by getting a root canal, you're saving a tooth, no. I'm going to do laser on your tooth and save it from being a burden on your system because I've came up with some latest technology, no. Biofilm colonies go deep within the tooth and there's no way to get them out.
So Doc, I just want to ask a question for in case we don't have the time for it. What happens if you do have a root canal? What is the best way, or you do have an extraction, what is the best way to deal with it?
Well, first, I want to know what caused that root canal for you. I need to put a stop to that first. If not, you'll be back in my office or someone else's office every few months, every years with another root canal. That's number one. Is it a systemic issue or a structural issue? And put a stop to that. That's number one. Number two, a root canal is a root canal. A root canal is a dead tissue. A dead tissue that's not getting oxygen anymore, that's going to attract biofilm. I'll show you a few cultures when we get there. You see how scary some of these things are. We took a tooth out. There's a dark hole back there. This is what they call cavitation. Her wisdom teeth was here. That infection, and we only saw it, this is before we had 3D imaging, by the way. Cavitation was back there. This is when we found out of it. Cyst, odontogenic cyst-like formations. Not the root canal. A fatty cyst connected to it. Another root canal. This was a parasite. Wow. This little guy, you guys, look at this. He had a nose, eyes, and ears. Immobile. Cavitation. 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 This is the gum that's over this area. I opened it up. Look at that dark goo. So if you tell me, if I take antibiotics, is it going to make my cavitation go away? If I get on your little spaceship, is it going to make the cavitation go away?
It will temporarily give you a pause until...
No. By increasing oxygen, you might be able to make it smaller. But this goo, this gangrene, it has to be surgically removed. Look at this one. This bone's supposed to be white. 6-year-old little boy. Now, remember how we talked about diamond, the hardest structure in the world, then you have enamel, then you have bone. These infection bones, I'm able to just put my instrument right in there. Completely diseased. Now, am I going to remove all his jaw and all the teeth? I can't do that to this 16-year-old boy. We did ozone trace. Ozone trace. These are some of, if we had infrared, you could see this ovum with these little parasites living in there. Look at this parasite. It's got 2 heads. It's twins.
Oh my goodness.
These are the structures that are removed from root canals, that are living at old cavitation sites. Up to 2 years ago, every time I clean one of these infections out, of course I would send it to the pathologist, and the pathologist would send me reports like osteonecrosis, chronic fibrosing osteomyelitis, just another schmazzy-mamzy way of saying gangrene bone. But now technology is advanced. We're able to see every virus, fungus, bacteria that lives within that specimen that I sent to them. E. coli, Candida, Immobia, parasite, one of the biggest ones.
Can you find that without pulling the tooth out, without going and digging in? Can you do
There are a few tests, sterile floss you can run by, send it to the laboratory, it'll tell you what's in there. Because remember, all these guys are constantly pooping and just grabbing their poop. I've had a Stanford doctor contact me. I don't believe in all this, so I want you to do it like the way I want you to do it. Go in, take a sample, send it to me. The day he got the sample, his wife was driving back to me again, with him, for me to remove that lesion.
Do a lot of these tooth infections also have concurrent infections in the gut?
Well, this is another manifestation of the gut.
Right, so it's all part of it.
And through the lymphatic. Remember, your gut is your first line of defense. You have more lymphatic connection in the gut than any other part of the body. Look at a lymphatic chart. It starts from right here. HPV 16, HPV 35. This is lurking in their root canals. What would you want to hold on to that tooth?
Can you go back?
And of course, you know, Mercury Fillings. One more minute?
Yeah, one more. We got one more speaker. I know
Okay.
it can go all day, sorry.
So I follow a very strict protocol. You know, my patient's covered from head to toe. Suction, I come in, I look like Darth Vader, protecting myself. I will not allow my assistant to be in that room. She's young, she's still gonna have babies. And let me tell you, no matter how I try to protect myself, every time I remove a mercury filling with all this gear, my mercury levels go off the chart. No matter how hard I try to protect myself. And believe me, look, I got a face mask on. I use different tools to protect my patient, remove the mercury in sections, and of course, what do we see? Fracture, fracture, fracture. Every other dentist would want to do a root canal and put a crown on this tooth. But you know, I am biomimetic. So I use my ozone to clean, ozonate the bejesus out of that tooth. I cover it with my Kevlar, and I rebuild, and I rebuild that tooth. Sorry, I jumped tooth. And I rebuild that tooth. I also pay a lot of attention to geopathic stress. So in my current office, I use a lot of driftwood in my office to protect me and my patients from Wi-Fi, EMF, what have you. No, we are working on a new office right now. It's going to be like freaking Star Trek. It's going to be my retirement. But yeah, so I look forward to the next one. And of course, electrosmog, huge. I pay a lot of attention to this. As you can see, these towers, and now they're hiding these towers behind trees here. Or, I actually stopped by and I talked to the pastor. He had no idea. All he knew was the cell company was giving him $6,000 a month to keep that behind the cross. This is a quick research that was done. They took a bunch of kids. They asked them to draw a person, just wiggly lines. Deep Mexico, Salulito. They had rice and beans. but no electromagnetic field, no Wi-Fi. They asked them to draw. They drew little kids. 10 days. So EMF, very important. UCLA just did a research. Why all these bacteria and viruses have become so advanced. Why they're fighting for their life. They've been around since the dinosaur era. There's nothing new. Conclusion, electromagnetic field. There's ways you can protect yourself too. We go back to structure. Again, unresolved trauma, very important. And you know, once in a while, after a long day, patient comes and gives you a note as such. It truly makes my day. Thank you very much, guys.